is blood administration. I'm going to go through the scale just like you should do it for skills day to get a pass. Okay? Most of the stuff that was in the PowerPoint, or everything that was in the PowerPoint, covers anything that will be on the test. Okay, so if you heard that, listen, you're understood, you're good for the test. Specific bones about the test. There are 2 questions regarding type of food, so you have to understand that to be able to figure those out. And then there's a safety question, there's real easy, and then there's something about the skill itself, and it's on this sheet, so you'll know it. It's the time you have, by the time you think about the blood bag before you infuse it or you get next to them. That's it. Okay. So, when you are testing, practicing, just practice it like you're going to test it and get it in your memory that way, okay? So that you're not all over the place. There are only a few deal breakers here as far as not being able to self-correct, regroup yourself. One of them is not obtaining baseline vitals. Before you spike the blood.
Look up the method.
You don't get baseline vitals and you spike the blood, I'm going to for sure
Okay,
get
and
my
then go to
temperature. You're going to have to start
incompatibility.
so you don't want to do that. And the
It
other deal breaker would be,
calcium.
again, spiking the blood without doing your check with your second person. Picking the wrong blood.
Because the calcium would come from
Even, once you get back with the wrong blood, that's going to be that'd be a fail. Other little things, if you change your order, okay? So what we're going to do is go by the checklist, and it says to verify your physician's orders on the table on the morning of your skills test. Everything will be basically like this. Only what you need is on the table. There's no extra stuff. Okay, so you're going to find your chart.
SOLE-dash.
It says type and cross for 2 units of packed red blood cells that over 2 hours each by Dr. Love. Okay, so that takes care of that first checkbox. While I'm here, I'm going to go ahead and pull out a consent form. And I'm going to do it in the room when I go out and get signed, so that's also something to check right, okay? Okay, I'm going to step into the room and I'm going to verify that Mr. Davis's or my patient has a patent IV and that it's a proper size for a blood transfusion. This will be real time, and you'll be actually flushing, okay? So don't just simulate, we're going to actually do it. So I'm going to wash my hands, I'm going to go in the room, introduce myself, Mr. Davis, what you can always do is taking care of me today. Dr. Love was in and ordered blood for you today. Can we talk to you about that? Okay, I'm going to have you sign your consent form that you sent to getting a blood transfusion today. If you'll just sign right here by the yes, and then you just simulate him signing. And I may ask you to look at the form carefully. And where would you witness your signature? Make sure you have your patient signing in the right place. Be familiar with these when you put it under a patient's nose is what I'm trying to get at, okay? So we have a consent form. Okay. So I'm going to verify Mr. Davis. Can you just tell me your date of birth? 3/25/1948. And that matches up with the record that says his order for blood. Okay, so we have Mr. Robert Davis. We've identified him. I'm going to take a peek at his IV, and it looks like a pink cannula, so that's a 20 gauge. So that is an appropriate size for blood transfusion. The site is clear without any kind of redness or swelling. I'm asking if it's tender, and he says no. Okay, and then I'm going to go ahead and flush it. Make sure that it's working. Arm doesn't want to stay flopped the right way. I'm going to scrub the hub. Brush my IV, my saline lock. And as I brush, I'm going to look for swelling or leaking. And again, tenderness. Mr. Davis, does that hurt? He says no. Okay. So we are good to go. So, just running back over the steps, I have an order. I have a consent form that he has signed. He has a patent IV that's a proper size for blood transfusion. And we have the right name, the right patient with the 2 identifiers. Okay. Before I leave the room, I'm going to get a set of vital signs. So I have a baseline, And when you say that, I will simply give you a set of vitals. Okay? So I'll give myself a set of vitals right now. And of course they're going to be spot on normal. Okay. So I have an order, have a consent, have my IV ready to go. I'm just going to set up my tubing and then I'll head to the blood bank and get my blood. Okay, so I'm going to grab blood tubing and a saline. Trash can. Okay, when you take this out of the package, close everything. Okay, we'll just cut down on grief later. Okay, so 2 clamps and the roller clamp. And I'm going to reuse this just to save supplies. And I'm going to go ahead and spike it with saline. I know this is not saline, but saline right now. Okay? And I find that the best way to alleviate the air situation is to just open this bottom roller clamp and let this fluid run to the end, and then worry about the drip chambers. Okay? We're just going to let this go full. Maybe we should open the saline. Must be, I think. Yep. Okay. Once it gets to the end, you want to fill your drip chamber. Up here you want to be able to see it, and it also has to completely cover the filter. Okay, so all you do is squeeze until it covers the filter. And then just enough so you can see it dripping, okay? And then just open this and let it flush this little other port.